Hello, my name is Dr. Meyer, and I would like to welcome you to the second installment of the Collagenase Santal Ointment educational series. So let's get started. Let's talk about wound bed preparation. In order for wound repair to progress normally, proper wound bed preparation is a must. The overall goal is twofold. We want to minimize the necrotic burden and promote healthy granulation tissue in order to stabilize the wound. There are some barriers to achieving a stable wound. The first is necrotic tissue, which prevents wound repair and may promote bacterial colonization. The second is the bacterial burden, which often increases the risk of infection. The third is excessive exudate, which can interfere with healing by causing cellular dysfunction and biochemical imbalance. Removing these barriers to healing will help produce a wound bed that is ready for the next stage of repair. When dealing with necrotic tissue, we want to find an optimal debridement treatment so that healthy tissue can start developing. The bacterial burden can be avoided by choosing the right agents to control infection. Finally, maintaining the proper moisture balance for your patient can help with excessive exudate. Here's a question for you. Which is your first step for wound bed preparation? Let's talk more in depth about how you can tackle the first barrier, the presence of necrotic tissue, with debridement. There are several treatments used to complete this process. As shown in this table, you can surgically remove necrotic tissue with a scalpel, scissors, water jet, lasers, or curettes. Or you can use physical or mechanical means such as wet-to-dry dressings, hydrotherapy, and ultrasound. Autolytic support relies on the body's own enzymes to dissolve necrotic tissue. Examples include films, hydrogels, hydrocolloids, and honeys. Enzymatic debridement is the topical application of enzymes such as collagenase to selectively break down necrotic tissue. When you are treating a patient with a chronic wound, which of these treatments is your primary method of debridement? Now, we can move on to the differences between debridement options. Although mechanical or surgical removal is an active treatment, it may not be selective and will not be ongoing. Let's compare enzymatic and autolytic debridement against the four goals. Enzymatic debridement actively removes necrotic tissue. It selectively attacks collagen strands and also assists with wound progression through the inflammatory phase. Additionally, it uses exogenous enzymes throughout the process to help prevent the reaccumulation of debris. Autolytic support does not meet all of these goals and only passively supports endogenous enzymes for ongoing debridement, and if effective, progression through the inflammatory phase. Currently, collagenase santal ointment is the only enzymatic debrider approved by the FDA. It is clinically proven to clear the way for healthy tissue. Collagenase santal ointment is indicated for debriding chronic dermal ulcers and severely burned areas. Occasional slight transient erythema has been noted in surrounding tissue when applied outside the wound. One case of systemic hypersensitivity has been reported after 1 year of treatment with collagenase and cortisone. Use of collagenase santal ointment should be terminated when debridement is complete and granulation tissue is well established. Santal ointment is both enzymatically active and biologically selective. Being enzymatically active means that it actively removes necrotic tissue to help prevent the reaccumulation of debris that can lengthen the healing process. Being biologically selective means that it selectively attacks and cleaves collagen. This frees the wound of necrotic tissue and cellular debris without harming healthy granulation tissue. Now, let's examine the other two barriers to wound bed preparation: infection control and moisture balance. Helping to control infection is vital during this process. It is important to choose products that are compatible with the debridement treatment. Santal ointment, the only FDA-approved enzymatic debrider, is compatible with a number of antimicrobials that help reduce bacterial burden. If an infection is present, these topical antimicrobials can be applied to the wound bed prior to applying santal ointment. Should the infection not respond, therapy with santal ointment should be discontinued until the infection resolves. Debilitated patients should be closely monitored for systemic bacterial infections. Which of these best describes your approach to preventing and treating infections. A recent article was published in Wounds 2012 by Jovanovic et al. That evaluated the compatibility of Santyl ointment with a variety of topical wound care products. Specifically, this reported the percent inhibition of the collagenase enzyme in the presence of these products. I have found this article to be very helpful when considering combination topical wound care treatment with Santyl ointment. Now that we have reviewed debridement and infection prevention, we are on to moisture balance. Using the appropriate dressings when preparing the wound bed will help maintain the correct moisture balance and manage wound exudate. If the wound is too moist, consider utilizing foams, hydrofibers, and crystalline sodium chloride gauze. For wounds that are too dry, hydrogels and hydrocolloids can help provide moisture. If the wound is balanced, simply using gauze can help set the wound correctly. Adding moisture to a dry wound is an important component to activate Santyl ointment. Which products have you used for moisture balance? Now, here is a case study that shows how Santyl ointment has been used successfully in my clinical practice. A 54-year-old man had no significant peripheral arterial disease and was healthy after a thorough workup. The wound was a traumatic right lower extremity ulcer in the setting of mild venous insufficiency. The wound was presumptively treated as pyoderma gangrenosum due to his reported classic pattern of pathergy. Santyl ointment was applied within the wound once daily for 2 weeks. Compression was accomplished with Tubigrip and a Cetapress wrap. The baseline wound is shown here. At day 17, we can see the wound and both the top and bottom surfaces of the plug following sharp debridement. Santyl ointment helped create a healthy granular wound bed without cellulitis, exposed bone, or purulent drainage. We had full debridement at this point. The underside of the necrotic plug clearly demonstrated a delineation of non-viable tissue versus viable tissue in the wound base. It is important to know how to apply Santyl ointment properly. The application protocol is easy to follow. First, cleanse the area. You want to remove as much loose debris from the wound as you can. Gently cleanse the wound bed with sterile saline or an appropriate wound cleanser with a pH of 6 to 8. When necessary, crosshatch thick eschar with a number 10 blade to ensure optimal surface contact. Next, apply Santyl ointment. You can apply the ointment directly on the wound or to a sterile gauze pad that is then properly secured. Apply the ointment at a 2 mm thickness, which is approximately the thickness of a nickel. Apply the ointment within the area of the wound once daily. You can apply more frequently if the dressing becomes soil, as from incontinence. Finally, dress the wound. Wounds with sufficient exudate will naturally activate the collagenase enzyme, but a dry wound may require additional moisture. Do not use dressings containing silver or iodine with Santyl ointment, as these ions inactivate collagenase, the active enzyme. If there are any clinical signs of infection, you may apply a topical antibiotic powder before applying Santyl ointment, as I mentioned earlier. If this infection persists, discontinue the use of Santyl ointment until the infection resolves. When you're using Santyl ointment, it is important to know how much to use. We have made this calculation easy for you by creating these dosing tables. Simply look at the size of the wound, and you can see how many grams per application are needed. For instance, if you are treating a 7 by 5 centimeter pressure ulcer, you look at the table and see that you will need approximately 7.5 grams of ointment per application. Next, you can use this table to see how many 30-gram tubes you will need for treatment. For instance, if you are treating this same pressure ulcer for 7 days, the patient will require 2 tubes of Santyl ointment during treatment. If you are treating for 30 days, the patient would need 8 tubes. If you visit Santyl.com, you can access an easy-to-use dosing calculator. Just enter the wound size and length of treatment, and all of the information for a proper order or prescription will be automatically generated for you. After this presentation, would you like to receive any of the following resources? In summary, Santyl ointment works with the 3 major steps of wound bed preparation. It works actively and selectively during debridement, is compatible with multiple antimicrobial powders, and can be used with a variety of dressings. Thank you for spending some time learning about wound bed preparation and Sansel ointment, the only FDA-approved enzymatic debrider. For more information, please visit Sansel.com.